Centerpoint Health is a regional healthcare provider serving Central Kentucky, and here today to tell us more about their recent rebrand and what services they're providing is the CEO and Market President of Centerpoint Health, Bruce Tassin. Welcome to the show.
Thank you all very much.
Yeah, well, we're glad to have you here. Can you tell us a little bit more about Centerpoint? This name isn't familiar to me, and I'm sure to some of our viewers.
Sure. So Centerpoint Health is Central Kentucky's LifePoint market. So LifePoint hospitals have been here for years and years in Central Kentucky. So Versailles, Paris, Georgetown, and Winchester. So in 2018, the four hospitals started working more closely together, and they were referred to as Central Kentucky. And so it was a start of a collaboration of working more closely together instead of independent individual hospitals, because they were part of the same corporation. And so this is the next phase in coming together in a rebrand. And that's where Centerpoint Health comes from. Center, Central Kentucky. And the point is 4 points in the whole heart of the brand of the heart.
I love that.
I do too. And I've lived in Georgetown a long time, and so I'm very familiar with the hospital there. So what do you think this is going to do for the community?
The big thing for us, for the community, is a coordination of care amongst our four facilities and our four communities. All four provide excellent care and service to the communities they serve, but people didn't recognize that we were all one, that we were part of the same organization.
I didn't know that,
And, you know, coordination of care. And so if you were in Winchester, which was Clark, or whether you was in Georgetown Community Hospital, we're really one of the same in that you can expect the same high quality care, the high service, and to share those best practices amongst those hospitals as one.
Yeah.
That makes sense.
Now, sometimes a rebrand doesn't go well. So I'm thinking of like when they do the new Coke, you know, that didn't go across very well. When Cracker Barrel tried to rebrand, it didn't go so well. How is it being received that you have this new brand?
Yeah, the Coke rings a bell because I was a kid at the time.
Yeah, remember?
And it was like, what did you do to our Coca-Cola? And so at that point, it was a product.
Yeah.
Yes.
Our product for care is awesome for our four facilities. And so our feedback thus far, our employees love it. They've been expecting to have a rebrand where it would pull the four facilities more closely together. But the community also, the biggest thing they questioned was, well, are y'all under new ownership?
Right.
Or are we getting new leadership at each one of the hospitals? And the answer is no. We're part of LifePoint, and our great leaders at each facility will stay the same. And so that really made them feel more at ease, that they're still their great community hospital, just in a rebrand of the same name for four facilities.
Okay.
Well, what is your background, and how did you get involved?
So I've been in healthcare for 35 years. So I've ran systems in Louisiana, New Mexico, and in Kentucky.
Wow.
So prior to being brought on to run Centerpoint Health, I ran the St. Joe Health System from 2015 to 21.
So you know your stuff.
I know the area.
Yeah.
Yes.
I'm sure there's a lot of challenges with our community hospitals. What are your all's biggest challenges that you're facing?
The biggest challenges is over time, insurance companies changing the way they pay for care and so forth. Getting approvals for certain type procedures for patients and so forth. So it's more of that struggle for the patients to navigate it. Is this hospital in service today? Is this provider in service today? So it's really us trying to help the community, educate them on how to figure that out and to make sure that they have access to care. Access to care probably is the #1 opportunity for all. And when I mean access, is primary care. Making sure people have a primary care doc. So preventive care will keep you from coming to the hospital and having to be admitted through the ED. So really building that network for our patients.
Oh, that's great.
Well, what does 2026 in the future look like for you guys?
We're extremely excited. You know, now that we are one under the new brand, and we have consolidated leadership within the four hospitals working together, coordination of care probably is the biggest opportunity. When you're in a smaller community hospital, sometimes it's harder to recruit good providers because providers are looking for a larger scope to practice in. Well, as a consolidated group of four, it will help us with recruitment of subspecialists, whether it's urologists, neurologists, primary care docs, to know that, hey, I'm part of a larger system. I can work in Georgetown and Winchester or Bourbon, Paris, and Versailles. So it helps us with recruitment and retention of great physicians into the communities that we serve. So we look forward to an influx of additional providers into our different areas as we grow additional technology. The other piece for us is we're pretty high tech. So if you look at Georgetown alone, we're very robotically equipped. So if you look at our surgical services, we have 3 Da Vinci robots, 2 XIs, and 1 DV5, which is the highest technology. We actually was the first hospital in Kentucky, or Central Kentucky, that came up with the DV5, which is amazing. We're actually a training site for other surgeons to come in and to be trained on those robots. And now we've extended those robots into the Clark Hospital, or now Centerpoint Health Winchester, and so forth. So growing the technology, advanced medicine, advanced technology for taking care of our patient population.
And it's right here in our backyard, no
Yes.
matter where you live in Central Kentucky. Well, thank you for being here,
Yes,
introducing us to this new rebrand of something that we all know and have relied on for a number of years. So thank you so much for being here today.
We appreciate it. Thank you all so much.
And we're going to have all of the information for Centerpoint Health up on your screen.